Good evening, everyone, and welcome to another episode of A Closer Look, the show dedicated to bringing you the facts. We ask the questions no one else will, and we get the answers that no one else can. I'm Arabina Apia. Thanks so much for joining us. Welcome to the Wellness episode. Now, if you think I'm here to tell you to eat well, exercise, drink water, mind your business, and meditate, then you'd be only partially correct. Because wellness is about more than how many pounds you can bench press or how many kale smoothies you can down in a day. It is quite literally about maintaining your mind, body, soul, and spirit. And that is the focus of the new wellness unit. We are coming to you live from the Bahama Resort for the official launch of the government's National Wellness Initiative. Now more than ever, the Ministry of Health is working to encourage wellness at every level of our collective and individual lives. But why? Well, I have 3 words for you. Non-communicable diseases, or NCDs. NCDs continue to plague societies worldwide. This despite the fact that around 80% of these diseases can actually be prevented. These diseases, more often than not, have a long duration and progress slowly. And because of that, the burden they create can have significant social, economic, and health consequences. Now, this is even more disproportionately so in developing countries like the Bahamas. Healthcare professionals estimate that 28 lives between the ages of 30 and 70 are cut short every single minute. Back in 2019, the Ministry of Health released the NCD Risk Factor Report. The 60-page document laid out some startling statistics regarding the state of wellness across our archipelago. It found that not only are more Bahamians dying today from NCDs than any other disease category, but they're also dying at younger ages. There is a 20% chance of a Bahamian dying early or prematurely from an NCD. In fact, in 2019, the Bahamas was identified among the countries in the region of the Americas with the highest probability of dying too young from an NCD. The probability here at home is 19.9%. Now that's when compared to the regional probability average of 14%. In Costa Rica, that number is at 9.5 at the low end, and in Haiti, 31.3 at the high end. But what can we do? How do we address wellness concerns at the policy, legislative, and regulatory level? How do we respond to the needs of people living with or at risk of cardiovascular diseases, cancers, diabetes, chronic respiratory diseases, or even mental health conditions? These are the questions that we hope to get the answers to today. From mental health to physical health, we're discussing all the ways that we can individually and collectively embrace a journey to a happier and healthier nation. Our conversations on wellness continue on the other side of the break. Stay tuned.
This moment truly has significance for our collective development.
A transformative health agenda is a key priority to this Davis-led administration.
You know, the Bahamas has many treasures, but our people are our greatest treasure. The Bahamian people are the strength and wealth of our nation. However, we can only be strong if we are healthy.
Now, for a large majority of the population, the word wellness may call to mind endless amounts of green smoothies and salads, or even an intense workout session or two, which is great, obviously, because your physical health does play a huge role in your overall wellness. But more often than not, our mental health is not given the same high-level priority. For members of the recently established Wellness Unit, the work of normalizing mental health care is a high priority. Joining me now to take a closer look is Raquel Curry, who is a professional therapist. Thank you so much for being here.
Thank you for having me.
Very nice to meet you. So let's talk about mental health. I think, in recent time, there's been a little more focus being placed on the importance of mental health and how we can sort of maintain our mental wellness. But there's still a lot of work to do, obviously. So where, in your professional opinion, where are we in terms of making mental health a priority in the way that we make physical health a priority?
So I think that the opening of this unit is a very big and great step towards the direction that we need to go. Bahamas Psychological Association, in conjunction with some other organizations, have been trying to provide services, free or paid, towards giving people the access that they need to mental health services.
How do you, I guess, what is the process? Because how do you reach people who are really just not interested? They don't see the value of coming to see a therapist.
See, the beauty of psychology is, I tell my clients this all the time, talk therapy ain't for everybody. You talked about the green juices and the salad and the smoothies. If you have a structured plan to taking better care of your physical health, it also improves your mental health. So you could be helping yourself biologically. You don't even have to talk to anybody. But I think there needs to be a recognition of confidentiality within this country, just in general. It isn't only just therapists, it's school counselors. I've had kids who don't want to talk to their guidance counselors because they're too busy, get sip inside the administrative office. You have kids who don't even want to talk to their parents because their parents could tell their aunts and uncles. So there needs to be a push towards confidentiality and understanding the seriousness of the matter. If I'm going to take the time to open up to you, I need you to
you need to reciprocate the energy.
You need to understand what I'm saying. And so we as therapists, usually when we open up a session, we'll say something like, this is confidential, just to give people some comfort and know. And I take that very seriously.
How do we also reach young people who may be struggling, who may be, dealing with some level of abuse or trauma or whatever it is? How do we reach young people? Because I think we don't often think about the level of pressure that young people are under. So in your experience, what has that been like, and how are you able to reach young people who are dealing with their mental health challenges as well?
So I love teenagers. That is definitely my most favorite population because they do feel like they don't have a space. And so I offer the space. As simple as that, right? And because I'm young and I'm on TikTok and I'm on social media, I'm half digital, half analog era. I'm able to relate.
Oh, to be a millennial.
I relate a little bit differently, right? And so usually I get that connection piece by saying that, right? They're worried about being judged. That is the biggest thing coming out of teenagers. I don't want to be judged for how I think, how I look, how I feel. And I'm like, sis, this is not a space for judgment. Just be yourself, be open. They need to have those spaces.
So I think my final question is, how do parents, how do young people, how do adults, if you understand that you're struggling with your mental health and you need help, how do people access you?
So the Bahamas Psychological Association actually has a website, but furthermore, you can reach us via email at bahamaspsychassociation@gmail.com. If you just Google, counseling centers, there are a number of options available to you. And it's funny that you asked. I'm in the works of creating a network, so that makes it very easy for people to find the therapists and the services that they need. So look forward to that because it's very necessary. So we need to start to create these things so that people have it as an ease of access, sleight of hand, and they were able to get what the services they need. There are some on the website. You would also see a suicide hotline. You can also visit the Crisis Center's website. Or Google the Crisis Center because they also have hotlines associated with them that are 24 hours.
Well, I want to thank you very much for being here.
Thank you for having me.
This has been a really insightful conversation, and I think we'll have to talk about some stuff before you. Thank you. Thank you so much for being here.
Thank you.
Our conversations on wellness continue on the other side of the break. Stay tuned.
I'm joined today by the dynamic Tanya McFall Major. She is a public health communications consultant. Tanya, how are you?
I'm great. Thank you for having me here today.
Thank you for being with us at the launch of the Wellness Unit within the Ministry of Health and Wellness. So, can you tell me a little bit about some of the emphasis that may be being placed on young adults, especially with this new launch?
Well, with this new launch with the Ministry of Health and Wellness, the Healthy Bahamas Coalitions, and even PAHO WHO, some of the things that we've been seeing is that there's greater emphasis placed on the age groups. If we think about it, persons in our age group, our stresses are kind of different. We're still coming off of the edge of the pandemic, and many persons are still having mental health challenges. We have many persons who say that, the game pandemic weight. So their focus, their focus is a little bit different. So let's be more considerate. Let's be more considerate about our community helpers around us. We are no longer an island, and let's be here for each other.
Thank you so much, Tanya, for helping us to destigmatize as well as bringing awareness, and of course, even the recommendations that you would have brought to us just now. If you need help, feel free to reach out to somebody, a professional. And thank you so much for all of this that you're doing within the ministry and along with all of the stakeholders that we need and it's necessary.
Welcome back. You're watching A Closer Look. Thanks so much for joining us. I'm Arabina Apia, and we are coming to you live from the Bahama Resort and the official launch of the Ministry of Health and Wellness's new Wellness Unit. Our roving correspondent, Marcos Ambrister, is in the room, and I believe he is being joined right now by a very special guest. Marcos, what can you tell us?
Thank you so much, Arabina. I'm joined now by the Honorable Minister of Health and now Wellness, the Honorable Dr. Michael Dovell. How are you this morning, sir?
I'm excellent, and it's so good to be here today for the launch of this long-awaited wellness unit, a part of the ministry.
So tell me, Minister Dovell, exactly how important is it for us to have this unit? Of course, it's been 49 years now that we've had a Ministry of Health. Why is it now that the ministry has decided to add on this new unit and the importance?
Well, as we travel internationally and we begin to learn what other countries are doing, we see that there's a great drive to wellness coming out of the COVID-19 pandemic. Coming out of the pandemic, we're realizing that our hospitals are now being filled with individuals suffering from chronic non-communicable diseases that are now decompensated and require in-hospital care. Our study and the STEPS survey that was done in 2019 prove that the incidence of diabetes, hypertension, and other non-communicable diseases is on the rise in the Commonwealth of the Bahamas, and it is important that we act now so that we can turn the corner and those individuals do not decompensate and begin to be a burden at our tertiary healthcare services. We are also working very diligently, as indicated by the Pan American Health Organization, to begin to move swiftly to beef up our primary healthcare components and disease surveillance as well as screening to pick up chronic diseases, cancers, and other things in their early stages so that we can implement treatment and begin to bring those individuals back to a healthy state and wellness.
So tell me, Minister Dovell, how important is the unit, this wellness unit, not only with our physical health, but also even down to our mental health? We've seen in recent years that mental health is now taking the front row seat with a lot of ministries when it comes to not just taking care of our bodies, but taking care of the whole man. Give us a little bit of insight on what the new unit will be like for wellness within our mindset.
Well, the Wellness Unit is the central nucleus to guide all of these other programs that affect human health. Give you an example. On coming to office, we made a commitment that we will move swiftly to repeal and replace the old Mental Health Act. That was done. And today, the new Mental Health Act has been enacted, and I'm about to bring it into force in stages. As we speak, we are training nurses with postgraduate diplomas in psychiatric care, and we are beginning to activate programs that deal with suicide, deal with individuals who suffer from anxiety, by putting the necessary clinics as well as programs in place to assist them. We're also putting together our new registry that will monitor chronic non-communicable diseases like hypertension, diabetes, so that we can look at the statistical data and research information so we can create policies at the Department of Public Health. As we move forward, our wellness unit will begin now to reach individuals at the community level and begin to address programs related to nutrition, related to exercise and mental health. These are the necessary tools that we believe will begin now to change what we're seeing in the population and turn that necessary corner back to a nation of good health.
Thank you so much, Dr. Dowell. We do appreciate all that your ministry is doing, and especially the newfound focus that will be on wellness. Back to you, Rabina.
Stay with us. We have even more show coming to you live from the Bahama Resort after the break.
I'm currently joined by Dr. Swan, who is a registrar at the Ministry of Health and Wellness. How are you today, Dr. Swan?
Thank you.
Are you well?
Yes, I am.
That's also good to hear. So tell us a little bit about the work that you are currently doing now at the Ministry of Health and Wellness.
So right now, in this particular mode, I am assisting with the organization of the wellness unit. And what that means is we're trying to ensure that we have the requisite programs in place, the connections at the community level, to ensure that once we start this program full-fledged, we will have the bodies in place to reach the community at the ground level. Talk about nutrition, talk about physical activity, talk about managing the finances, your mental health. How do you interact and make sure that you are engaged and remain viable and productive citizens.
Thank you so much for all of that information, Dr. Swan. We look forward to seeing all that it is that the ministry is getting ready to do, and of course being benefactors of all of those initiatives. Thank you.
Welcome back. You're watching A Closer Look. Thanks so much for joining us. So far, we've discussed the impact of non-communicable diseases on the Bahamas. But this is not a problem that's unique to our shores. In fact, our regional counterparts also share these issues. Joining me now on the desk to discuss how we tackle the issues of wellness from a holistic regional standpoint is Dr. Eldana Boisson of the Pan American Health Organization and World Health Organization, or PAHO WHO. Welcome to the show.
Thank you so much.
Okay, so Dr. Boisson, obviously the issue of non-communicable diseases is not unique to the Bahamas. It's an issue that a lot of regional countries are facing. How do we really attack this issue from a regional standpoint?
Sure. So yes, indeed, the issues related to non-communicable diseases are not unique to the Bahamas. The leading causes of death are things like cancers, hypertension, stroke, heart disease, and so on. And that's the same in Bahamas and the other countries as well. So from a regional perspective, there's several strategies that are being used and have been shown to be successful in some countries. There's a HEARTS initiative, which is one whereby persons take control of their health for cardiovascular disease and diabetes. There's also legislation, for example, for tobacco control, for control of sugar-sweetened beverages. There's community engagement initiatives. So there's several different initiatives that have been tried and tested in different places, many of which the Bahamas is already embarking on.
And are you pleased with the level of engagement that we are seeing locally and across the region in terms of wellness as a movement, as something that people are actually invested in?
Sure. So, health literacy is one of those legacies of COVID-19. Right now, people are much more informed and they ask a lot more questions. And so that's a good thing. And so in health, we have to be prepared to provide the answers, So I think we've actually had a boost from COVID-19. There's been some good, and I hope to see it continue in that direction. We need to continue as health professionals to be challenged by the population with the questions that they need to have answered.
I want to thank you very much for joining us. Stay with us. We have even more show coming to you live from the Bahama Resort after the break.
I'm here at the launch of the Wellness Unit of the Ministry of Health and Wellness, and today I'm joined by Miss Donna Bannister. How are you, Miss Bannister?
Fine, thank you. How are you?
I am excellent. Can you tell us a little bit about the importance of this new unit within the ministry, and of course what it is, the work that you are doing with us?
The launch of the wellness unit is a very important aspect of health. We're talking about well-rounded wellness. We have a lot of persons in our community in the Bahamas who are suffering from what we call non-communicable diseases. And what it's doing is taking a toll on the population. And so what the minister's plan is for the Bahamas to be a more well place.
We really do appreciate that outlook of just not being well within our bodies, not just being well physically, but ensuring that we are well psychologically, mentally, emotionally, and all the other leads that we can possibly be well. Thank you so much.
Welcome back. You're watching A Closer Look. Thanks so much for joining us. A Closer Look is live today from the Bahama Resort, where the Ministry of Health is launching a new unit aimed at encouraging wellness at every level of society. Marcos Ambrister is in the room. Marcos, who do you have with you?
All right, thank you so much, Robin. I'm here right now with Dr. Sharita Moxie, who is the lead for policy and planning within the Ministry of Health and Wellness. How are you this morning?
I am doing wonderful.
Thank you so much. I was able to catch a little snippet of your presentation this morning. Can you give us some of that information? Can you share with the Bahamas exactly why the importance of this new unit of the unit of wellness within the Ministry of Health and Wellness?
So I'm happy you asked the question, and I think why this is significant and why this is important is because what we are recognizing is that not only are we progressing in a negative direction with regards to non-communicable diseases. So more of us are hypertensive, more of us are diabetic, more of us are overweight, more of us have high cholesterol. And so I think undergirded by all of these facts, we recognize that as the Ministry of Health and Wellness, we really need to be advocates for change. And again, recognizing that we cannot do it all. So this is really about partnership. This is about us being able to stand and partner with you, with civil society, with private sector to say, we need to ensure that our people are well.
Tell us how important it is for us to just take a real step to the number one problem, which is wellness and health, before we even look at other problems that can possibly be happening.
Yeah. So you pointed something that was very evident for all, not just in the Bahamas, but globally. And that is that persons who had non-communicable diseases were often the ones that had the more severe disease. But beyond COVID, I think the reason, the rationale, the impetus for us wanting to move to that state of wellness is we want to be around. For those of us who have children, we want to be around for our grandchildren. For those of us who have parents, we want our parents to be around with us. And we want to be able to be thriving and prosperous. We don't want to have the vast majority of our society in states of disability and unable to participate in the country that we call home.
So true. Thank you so much, Dr. Moxie. Thank you so much for your advocacy within the Ministry of Health and Wellness and all that is that you guys are doing to ensure that we are healthy, wealthy people for another 50 years to come. Thank you. Back to you, Robina.
Well, thanks so much, Marcos. That was very interesting stuff indeed. Stay with us. We have even more show coming to you live from the Bahama Resort after the break. Welcome back. You're watching A Closer Look. Thanks so much for joining us. I'm Arabina Apia. Joining me now at the desk are some folks who will hopefully be able to provide some insights into how we can better fund our individual and collective wellness journeys. Because as we know, wellness ain't always cheap. Joining me now are the Deputy Managing Director of the Public Hospitals Authority, Dr. Kevin Thompson, and the Managing Director of the National Health Insurance Authority, Mrs. Christy Butler. Welcome, ladies. So I want to talk to you both about, this sort of culture that we have of, a souse-out or a cookout in order to fund medical expenses. In your experiences, is that something that we are still seeing a lot of? And how can people really be more intentional about, their options in terms of funding their wellness journeys?
We are seeing quite a bit of persons who have lost their ability to pay for their private insurance as we see the economy As we see the economy go up and down, that usually signals that persons have lost their health insurance. And that is where the Public Hospitals Authority come in. We are not in a position, the government of the day, the government of Bahamas has a mandate that we see all patients regardless of their ability to pay. And so when a patient appears or presents at any of our institution and they lack the ability to pay, they are then billed. They will be seen and they're billed later. In instances of catastrophic care like cancer, these persons would be put in touch with health social services, and they would assist them in getting into that system where they would receive a med card so they can get their medications at no cost, and they can get their treatment.
So if you are a Bahamian who is in need of healthcare, whether that's needing to go to your primary healthcare physician or maybe that's you need to see a specialist, what is the protocol? How do they access these services?
Sure. So the first thing I want to clarify is NHI is different than NIB. Right?
Understood.
National Health Insurance Authority, and we're often confused. The National Health Insurance Authority is very easily accessible. You can go to our website, www.nhibahamas.gov.bs, and you can enroll online. You're able to look at a menu or an option of primary care providers. You're able to choose your provider, and then you can have a relationship with that provider. That also allows you access to laboratory services, and very shortly we'll be bringing on diagnostic imaging and other screening services. That allows you an entry into the healthcare sector. Your provider is able to provide wellness visits, sick visits, screenings. And if it is that you need the specialist services, we're very well connected with the entire public sector, inclusive of our partners at the Public Hospitals Authority and the Department of Public Health. And so check out our website. We're located on East Street and Purpose Way. We take in-person enrollment and applications, and then you can also phone us at 396-8500.
Well, ladies, I want to thank you very much for being here and for having this very interesting and timely conversation with me.
Thank you for having us.
Thank you so much. When we return, our closing remarks. Stay with us. There's more of a closer look after this. So, what have we learned today, class? We've learned that wellness isn't just a fancy word for self-care. We've learned that our personal and collective wellness is about nourishing every part of ourselves, body, mind, and spirit. And let's face it, we all need a little TLC in those areas from time to time because we're constantly being bombarded by stress, pressure, and expectation from all angles. We're expected to juggle work and family and friends and everything else under the sun. It's no wonder that oftentimes, if you're like me, you wake up already needing a nap. But here's the thing. Wellness isn't just a one-time effort. It's a lifelong journey. It's a commitment to ourselves that we make every single day. And that can be tough in a world that's always go, go, go. It's easy to put our own needs on the back burner in the hustle and bustle of everyday life. But trust me when I say that it's worth it to take a step back and prioritize your well-being. Whether that means hitting the gym to get those endorphins flowing, or taking a quiet moment to meditate and clear your mind, or simply indulging in a good old-fashioned bubble bath and some self-care. So let's all make the pledge today to take better care of ourselves in every way possible. Let's prioritize our mental health, our physical health, and our emotional health. Let's embrace self-care and let's make wellness part of our daily routine, because when we are at our best, we can give the best to the world around us. Till next time, everyone, I'm Arabina Pia. Good night.